Welcome everybody to the launch of the Sexual Violence Research Initiatives and the World Bank Group New Voices from the South series. I am Liz Dartnell, SVRI's Executive Director, and have the great privilege to open this webinar for the launch of the report on research that the SVRI and the World Bank Group have supported in Africa. This is one of the series of publications we'll be sharing with you over the next few weeks. But before I start, I'm going to ask Liesl to put up the slides. But before I start sharing today's agenda with you, first some housekeeping. Next slide, please, Liesl. We're going to be together for an hour to share and discuss research on violence against women in Africa. The event platform that we're using is Zoom, and we are being recorded. So our online participants will be muted, but for those of you online with us today, we really ask you to share your questions in the chat and invite you to introduce yourself and tell us where you are in the world. The webinar is going to be recorded and shared with you via email and will be uploaded onto the SVRI and World Bank Group's websites. Wordly is available for translation into multiple languages. So to use Wordly during a Zoom session, you can click on the downwards arrow after custom live streaming services on the top left-hand corner of your screen. If you can't share that, see that link, Lisa will share the Wordly link in the chat for you. When you select View on Custom Live Streaming Services, that will launch Wordly in a browser window. Select the language of your choice, resize the window so you can view the Zoom session, and you can either read the translation in text form or click on the speaker icon and hear the audio. Wordly works on Chrome, Safari, Firefox, or Edge, not Internet Explorer. So next slide, please, Liesl. We have a really packed agenda for you today, rich with extraordinary researchers from all around the world. Dr. Chichi Undi, the SVRI Board and Leadership Council Chair and Senior Associate at the Population Council, will start the panel with a high-level overview on the status of research on violence against women in Africa. Chichi's presentation will be followed by a panel discussion moderated by Diana Arengo, Senior Gender Advisor at the World Bank Group. Diana and our panel of experts will discuss the importance of research on violence against women in low and middle income countries led by low and middle income country researchers. On our panel is Dr. Pinky Mahlangu from the South African Medical Research Council, Peg Baven and Sylvia Owina Okenyu from Sendakau, Kenya, Professor Nitu John from Columbia University. We will then end the panel with a presentation from our own Angelica Pino, SVRI's Grant Manager, on the Voices from the South Africa report. We are going to be really busy over this next hour. So I'm going to start immediately by handing over to Chichi to talk about the state of research on violence against women in Africa. Over to you, Chichi.
Thank you very much, Liz, and hello everyone. It's really a pleasure to be here. Apologies that my bandwidth can't take my video, so my camera is off. I thought that before focusing in on the African region, that we should sort of take stock of the status of the field globally in terms of the profile of the issue of violence against women and the funding trends that impact the state of knowledge on violence against women, or VAW. You'll agree with me that the profile of VAW is higher than ever before. There have been a lot of gains and discussions during COVID times, including on the high levels experienced by women and children in their homes, and the need to have post-COVID recovery plans with a gender lens. And the heightened attention to the issue reflects the strength and the power of women's and feminist movements and the impact of public health research across the world. However, it seems that high-income countries have been able to leverage this much more than low and middle-income countries have, for various reasons, including greater access to funders, language bias in the field, and so on and so forth. And funding for this work in the field has been impacted by multiple forces as well, including the impact of COVID on economies, Brexit, and the subsequent cuts in foreign aid, the politics of the right wing in many high-income countries, more funders are prioritizing VAW, but the research is uneven and still very small compared with the size of the problem. And there have been major announcements this year still during and after conferences, such as the Gender Equality Forum, but far too little gets to LMICs, whether it's for services prevention efforts or for research. Next slide, please. So what do we know about violence against women? If we had to speak about it in a few seconds, I'm sure you'd agree with me that we know more now than ever before, and we have a much more robust knowledge base than ever before. We have made great strides when it comes to understanding the prevalence and the drivers of VAW, particularly when it comes to intimate partner violence. Great strides as well when it comes to violence against women prevention, although admittedly, a lot of this is happening outside the context of conflict and humanitarian settings. We've made a lot of progress on supporting survivors better, particularly in LMICs. And also we have a much greater understanding of the violence experienced by groups that have hitherto been overlooked or marginalized. Next slide, please. And so drawing from the evidence base that we do have, we also now have a handful of well-powered studies. I know the studies on this slide will be familiar to everyone that is called in today. These are studies that show positive findings of the effectiveness of programs for reducing VAW, promising programs that include community mobilization and social norm change programs, such as SASA or couple-based programs, such as Indashikirwa in Rwanda, programs that target gender equality and poverty, such as Stepping Stones, Creating Futures, and Image. There have been groundbreaking interventions developed and tested in East and Southern Africa, focusing on microfinance and gender, parenting, multi-component interventions, school-based interventions, community-based interventions, and so on and so forth. So, there is promise. But I'd like to also touch on, who is doing this research on VAW and where. Next slide. So what we're finding is that research in the field on the African continent has been concentrated in very few countries. We know from a systematic review, although this review did focus solely on quantitative studies, but it examined the prevalence of gender-based violence, and this included both intimate partner violence and non-intimate partner violence among women in sub-Saharan Africa. And it found that a relatively large number of studies were situated in the countries that we have up here, primarily Anglophone countries, really, Nigeria, South Africa, Kenya, Ethiopia, Uganda. The review also really referred to studies only published in English, so that continues to be an issue. And then there's a policy brief by the Institute for Security Studies in South Africa on how violence against women and children is represented in research. And what this found was that most research takes place in poor communities and in rural areas, and poor Black communities in particular. What we find is that this is not so different from the rest of the continent. And what this brief argues is that this sort of representation can create a perception that these particular kinds of communities are the problem, quote unquote, or are more violent than others, thereby reinforcing racial and class prejudice. And this same brief also points to the fact that even though Black communities are the focus of most of the violence-related research in South Africa in particular, there's still poor representation of Black researchers or those from previously disadvantaged institutions in research teams, especially as principal investigators. So there's a lot of research conducted mostly by researchers from or based in high-income countries, although we have seen an increase in the number of partnerships between local teams and externally based research teams, or even better, research conducted fully by local research teams. This is particularly the case with research funded by the SVRI itself, but also with other funders such as the Evaluation Fund and so on. Next slide. So research gaps and a global shared research agenda. Many of you will already know that the SVRI, in partnership with the Equality Institute, has spent the past 2 years facilitating research and informed dialogues and discussion, drawing on the wisdom of the crowd to co-create research priorities for the next 5 years for fair, effective, and relevant research on VAW in low and middle income countries. For the first time, the voices of practitioners, researchers, and activists have sat centered and equal alongside academics and other specialists in the field. And up here on the slide, you find the different domains of focus, research to understand VAW in its different forms, intervention research specifically, improving interventions that already exist, and then methodological and measurement gaps. But to identify the global research priorities and ensure that the process was fair and transparent, what SVRI and the Equality Institute have done is to adapt a particular method that considers the views of multiple stakeholders, so not just technical experts, and ensuring that views are treated equally without some voices being more dominant than the others. And it does this by crowdsourcing multiple opinions on an issue, which helps to surpass the expert, quote unquote, judgment of one person. And so the global shared research agenda revealed that there are 5 top research questions for the VAW field. And I'm going to read these out, starting with in the order of those that scored the highest. So first of all, what types of interventions can effectively prevent multiple forms of violence and why? What types of interventions are most effective for preventing IPV? How are new feminist social movements positively or negatively influencing different perspectives related to the experience and perpetration of violence? What interventions work to prevent sexual harassment in institutional settings? And what are the impacts, including disability-related impacts of under-researched forms of IPV on women and girls? So that's it in a summary, and the SVRI is working to unpack this agenda regionally, starting with the LAC region, then EAP, and then moving on to EECA, MENA, and Africa. Next slide, please. So in terms of tracking funding for VAW research and the challenges associated with that, investment, first of all, is small, given the size of the problem. Country case studies show that even with policies that support evidence-based programming, very little funding is allocated to research. It's hard to track funding. Not all donors update their aid data onto the OECD database. It's difficult to identify projects encompassing research from the umbrella of GBV activities. Few donors break down their funding for specific activities in their financial statements. And what the interviews in this particular study are showing is that research is often a component of larger multi-component GBV projects. And so grant recipients have a hard time distinguishing research costs as a subcomponent of a program or as a cross-cutting issue across programs. And while the interviews show that grant recipients mostly have good relationships with donors, one of the things respondents note is that the priorities of donors often dictated the research agenda, and that helped govern the decisions about what kind of research is supported. And one respondent went so far as describing this as having to expand like an accordion to accommodate donor preferences. And few respondents were able to approach a donor with a research proposal. Most respond to calls for proposals. And then research and knowledge production was not often linked to action. Next slide, please. So standing back from all of this information, what do we need to do? You'll find that this list is sort of like what we have already begun to do. And so I suppose we just need to really intensify efforts. And because I think my time is probably up, I will not read these out, but I will just maybe focus on the last bullet point there on strengthening knowledge exchange among researchers from Africa who, number one, are separated by language barriers imposed by former colonial powers, and who, number two, might just be unaware of the evidence produced by their peers next door. I will end on that note, and thank you very much for your attention.
Thank you so much, Gigi, for that presentation and for giving us an overview of where the field stands in Africa right now. It's my pleasure to be able to moderate the panel with specialists in the region, working on the region, to talk about some of the areas for research, some of the things that they've learned while conducting research. So let's just dive in. We don't have a lot of time, so let me dive in. And Pinky, let me start with you. I wanted to ask you what you thought the gaps were currently addressing violence against young women in Africa. What are the research gaps? What are the gaps that we should? Pinky, did I lose you?
I'm here, Diana. Can you hear me?
Yes, yes.
Yeah, sorry, I'm just going to turn my video off. My
Okay.
internet is unstable.
Okay.
So thank you for that question. So I guess what I'm going to say right now draws from the work that we've conducted with young women in South Africa, but broadly in Africa. So what we've found in this work is that the research continues, to highlight that there is high prevalence of sexual violence experienced by young women in higher education campuses specifically. And this is mainly amongst the first-year female students who are the ones who are most vulnerable to the experience of sexual violence. What we've also learned is that the sexual violence impacts negatively on young women's mental health, also on the educational outcomes, and also increasing the risk of acquisition of HIV and STIs. But also the COVID-19 and the lockdown has kind of exacerbated the burden of mental ill health amongst young women. So one of the gaps that our work has highlighted is that there's lack of evidence-based interventions to prevent sexual violence and address mental ill health amongst young women in campuses in Africa in particular, because what we've learned is that many of the interventions that have been tested, they have been developed, yes, and tested, but mainly in campuses in high-income countries and not necessarily in our settings. Another thing that we've learned is that, in our efforts of preventing VAW amongst young women, there's sort of been a neglect in terms of programming and intervention development, focusing on LGBTQI women, whom we've identified as another key vulnerable and high-risk group for sexual violence and mental ill health. So what our work has showed is that there is a need for developing evidence-based interventions that focuses particularly amongst LGBTQI women. But also, as we engage in these sexual violence prevention efforts, there is still a need to engage men. That remains a critical gap because most of our focus is only on the women, yet the men are the ones who perpetrate sexual violence. So while we are doing this work, I just want to highlight this last point, which is the need to engage men in sexual violence prevention efforts. Thank you very much, Diana.
Thank you, Pinky. That's great. And a lot of very concrete recommendations. Thanks so much. I'll come back to you with another question at the end, but let me now move on to Sylvia. Sylvia, you were a part of a team that won an SVRI World Bank award to conduct some research within the SENDA-CAL program. And I just wonder if you could share with us what the impact of that award was on the program and on your work in Kenya.
Thank you, Diana, for that question. Just to give a little brief about that research, it was conducted in Western Kenya, and it was to understand how effective gender transformative economic empowerment approaches are reducing intimate partner violence. And the results that we got from the research indicated that 41% of the ever partnered women have experienced physical and/or sexual violence during their lifetime. And therefore, this confirmed to us as SENDA-CAL that there is high prevalence of violence in our areas of coverage, and our programming needs to include prevention of violence. Overall, the research impacted on SENDA-CAL programming in 3 different areas, especially in improving the capacity to respond to violence within the communities that we work with. One of the mandates of our research partners, that is Global Women Institute, was to train the staff of SENDA-CAL on GBV concepts. And as a result of that training, our staff acquired skills and knowledge that now enable them to deliver GBV training sessions within the community. And as a matter of fact, SendACOW is in the process of including GBV sessions in our gender and social inclusion modules. Secondly, the research also improved our data collection on intimate partner violence. We were able to develop a tool that we use to collect that data. And we have also incorporated this tool into our survey tools that we use to collect impact data. And we're using this data to inform the interventions that we are developing for our programs. The research also gave us a learning, and this learning was that even though the economic empowerment approaches are reducing the stressors and the triggers of violence, violence still continued. And this clearly shows that we are not adequately addressing this violence within our project. So we learned that we need to address attitudes, we need to address norms within the communities that perpetuate gender violence and that make women feel that violence is something normal, something that is accepted within the community. In our future steps after this research, SendACOW intends to disseminate this research in international forums and even the national forums and even through publications. SendACOW has now incorporated tackling attitudes and norms into our gender and social inclusion program. And we are working into improving our transformational methodologies to respond to these norms and attitudes. Thank you.
Thank you so much, Sylvia. I mean, I think having won that award had quite an impact on the program from what you've shared with us. So we're so happy that you were able to benefit so much and that your program changed and now is really addressing gender-based violence as a core issue of your program, but also measuring so we know in the future the impact of these new things that you've incorporated. And it was great that you were able to have a partnership with the Global Women's Institute to carry out that work. So that's great. Let me turn to you now with your work in Nigeria. And often what I hear is that, economic empowerment is so essential to addressing GBV. And I was wondering what you have observed. What are the effects of economic empowerment on GBV in the communities you've worked or in the research you've conducted?
Thanks, Diana, for the question. And I think it builds on Sylvia's talk a little bit. And I'm going to talk more generally, not so specifically to my project, but just based on the literature. So like you said, economic empowerment is often touted as a magic bullet that can foster gender equality and reduce violence. And there are several pathways by which we can see this relationship between economic empowerment and violence. For instance, it can move households out of poverty. And so you have reduced poverty-related stress and conflict. It can increase a woman's bargaining power within the household. It can increase her status and her ability to negotiate better outcomes for herself. It can provide women with more options so they can leave abusive relationships. However, when we look at the evidence, the empirical evidence of the impact of economic empowerment on IPV, we see a mixed picture. Specifically, when we look at women's work and whether it's associated with IPV, we find both studies showing increases in IPV versus decreases in IPV. Similarly, when we look at specific economic empowerment interventions, when we look at standalone cash transfer programs, for instance, they have had some amount of success in reducing IPV, but when we look at microcredit and other livelihood programs, we find that they generally don't really have an effect. And there's some evidence that they can actually increase violence, particularly certain forms of violence, such as controlling behaviors in the financial spectrum. Similarly, when we look at women's asset ownership, whether it's property or land, again, there is no clear evidence in terms of whether it reduces IPV. So why do we see these conflicting results? I think one thing to acknowledge is that when we look at, particularly when we're looking at women's work and its relationship with violence, we often rely on cross-sectional data because that's mostly what is available to us. And we are not really able to tease apart whether the women started working because they were experiencing IPV or vice versa. Then the other important thing to acknowledge is quality of work matters. While any work can be empowering to some degree, but work should be able to provide sufficient resources and protections that a woman is actually able to exercise her choice and leave an abusive relationship. And in many contexts that we work in, women often, are in the informal sector and they really don't really have the security of earnings and the protections that they can actually leave a relationship if they want to. And most importantly, I think, is the role of gender norms, which we really can't ignore when we're doing programming, because they can operate in several different ways. At one instance, if a woman starts working outside the home and she transgresses traditional gender norms, she's likely to experience backlash from both her partner as well as other men. Her partner in particular might feel threatened that his breadwinner position or his household headship is being challenged. And even if a woman has enough resources, these gender norms can be very pervasive that she's not able to challenge the existing status quo, particularly in contexts where it's not really easy to get divorced and sort of move with your children to another household. And the other thing that we've noticed is in the literature is that context does matter. So in places, particularly at the national level, if a lot of women work in the formal economy, you do find a negative relationship with IPV. But at the individual level, if a woman is working in a context where other women do not work, she's more likely to experience violence. So I guess the main point is that you can't just focus on economic empowerment. You really have to think about the underlying gender norms, the broader structural gender inequalities, and I guess that's where the field is also moving towards more multi-component interventions that integrate different elements and really look at the broader social ecology as we do our interventions. Thanks. That's it from me for now.
You're perfectly on time also. So great. Neetu, I mean, what you just said makes me think of what Pinky said to us. We have to always engage kind of men and boys also in this work. And it also makes me think of women's empowerment is we can't chop up a woman and economically empower her, politically empower her. I mean, when we measure her empowerment, her ability to choose, to have a decision, to have power over decisions at the household level, really kind of when we measure women's empowerment, measuring all those domains is important because we might be missing part of the picture if we don't look at women holistically. So thanks for that, Neetu. That's really great. Peg, let me move on to you. With the Women's Sustainable Development Goal, there's many organizations that work on women in Africa to empower women in Africa. And they often at times don't have an explicit aim of addressing gender-based violence. Do you think it's important for those organizations and those programs to interrogate how all women and girls-centered programming may be used to address gender-based violence?
Definitely is my short answer. My longer answer is that we know from wide-ranging research that violence against women and girls in Africa is very prevalent, even if at times it's hidden. So we know that it's very high in communities, but it hasn't always been overtly talked about. And it's such a huge challenge. And therefore we need all organizations to be working on it. So any organization that is seeking to empower women and girls, they need to consider that violence will be there in the communities where they're working and may well be a factor in the challenges that are facing at least a proportion for women and girls. And I think a lot of organizations are working blind on this element, and they are doing fantastic development. You know, Sendikau was doing the same thing, you know, delivering incredible impact, but not necessarily being aware that violence was either there or what the impact of their approach. And we know that violence impacts every aspect of a woman or girl's life, you know, their health, physical, mental, the education levels, economic capacity, relationships, self-worth. So whatever organizations' development programming is aiming to address, then any violence that is there will be impacting the outcomes of the work that they're doing, and the whether women can engage in that development or fully benefit from that. You know, violence will have a factor on that. So, you know, it feels to me to be key to assess a wide range of approaches. You know, some that don't necessarily aim to tackle violence directly, but can have a contributing factor. So this is part of what our research that Sylvia was talking about, our economic and social empowerment approach, reduced violence. But we also learned that we could be more effective by deliberately addressing the deep-rooted gender norms that both Sylvia and Netu, you know, touched on, the things that normalize violence. So there's an awful lot that organizations can do, even if they're not specialists. So I'm not remotely implying that every organization needs to become a gender-based violence specialist, but I would like to see organizations becoming aware of the presence of violence and its impact on women and girls wherever they're working, so they can factor it into their approach, but also they can then draw on the expertise of specialist gender-based violence organizations to improve how they're tackling that. You know, we talk in Sendikau about confident and thriving communities, but I don't believe we can consider people to be thriving if behind the scenes women and girls are suffering from violence.
Thanks so much, Peg. I completely agree with what you said. And I wanted to kind of to pose a next question to the whole panel, because I think we're increasingly bringing together the fields of violence against women and violence against children, and understanding that there might be important opportunities to addressing violence against children and violence against women at times with the same intervention. How do you, thinking of the research agenda in Africa, how do you think this kind of intersection between violence against women and violence against children impacts the future research in Africa? Any thoughts on that? Anyone? Pinky, I don't see you, but hoping you can come in on this. Sylvia, any ideas or any thoughts on that? No? There are some questions that are coming through in the chat, so maybe we can take this question up again and give you all a little bit more time to think about what are those opportunities, or what does that mean for the research agenda in Africa. Hope Pinky's still with us as well.
I mean, I can just generally make one comment.
Okay.
It just shows that, you know, this household level is so important. Just like you said, there are these important, you know, intersections, and a lot of the behaviors that cause violence against women also cause child maltreatment and other forms of violence against children. So I think this focus on households and couples, and we're seeing a lot of evidence there, the fact that you can work with couples and you have these gender transformative programs that can work at the household level. So really focusing there and doing these more multidimensional programs, I think is really a great way for the field to move forward and not really be siloed into these separate fields. So I see a lot of opportunities in the future. I'm sure there are a lot of nuances to it. I work more on the violence against women side, but I do see a lot of opportunities, particularly at the household level, where we're often scared to sort of intervene. But I think we have seen that a lot of the couple approaches are working, and it's a useful way of perhaps moving forward in Africa and other low-income settings.
Just to come in that any approach that is trying to impact the gender norms that we've talked about and the drivers of violence are surely going to impact both violence against women and violence against children. And as Netu said about working with couples, but we also work at the whole family level, so that the children are involved as well. And obviously that is going to be very key. You know, there's a lot of drive to include men or focus on men, but if you include the children as well, then these things are going to impact ongoing generations to come.
Great, thank you. And Sylvia, I think you wanted to add something. Pinky, I'll go to you after Sylvia.
Okay, I'll go, Sylvia. I just wanted to piggyback on Peg's point. Definitely working at the family level is a key strategy. I mean, if you are aiming to impact intergenerational violence, there is a need that you also work at the family level. So working together with the family, but also focusing the work at the school level. We've found in some of our work that, you know, as you involve the parents working at the family level, but also working and involving the schools itself, the school providing one of the settings in which we can make an impact. So school-based interventions that involve families are also critical and found to be effective in addressing some of the intergenerational violence. Thanks.
That's great. I was just thinking the same. Schools have such an important role to play in really questioning the use of violence against women, against children, and trying to challenge those norms and behaviors. Sylvia, over to you.
Diana, sorry, I keep losing sound. I guess that's why I didn't respond at the first call of my name. But I wanted to say that focusing on the family is really a way to go, because there is a lot of closeness in the violence that happens within the family compared to what happens in the community. What I mean is that what happens outside in the community, the violence that is outside in the community, is more talked about than what is happening within the family. So focusing interventions at the family level will really be a great stride in tackling violence that is so close and that is not talked about. Thank you.
Great. Well, it was a pleasure to be able to speak with all of you today on these issues, on research on violence against women and violence against children moving forward in Africa, on some exciting things that have been happening already, and the transformation of Sendikau through the award that they received, but also kind of understanding where are the future programs that we have to focus on, looking at women holistically, empowering them, not just economically, but in all the realms needed for them to have voice and agency, working through schools, working with adolescent girls, working at the family level, including men and boys in these conversations. So I think it was a really rich discussion in the very short time that we had. And let me hand it over now to Angelica, who is going to present some other research findings stemming from the SVRI World Bank awards. So thank you so much to all the panelists for spending some time with us today.
Thank you so much, Diana. Thanks for the panelists. So let me move on now to telling you about our grant-making program. So in 2014, the SVRI began a grant-making program to support researchers in and from low and middle-income countries. Our program provides grants ranging from 40,000 to 200,000 over a 2-year period. The SVRI puts out a call for proposals every year, and once the proposal is approved, we continue to provide technical assistance, especially on ethics and research uptake, strengthening the capacity of researchers to think about how the essential audiences for their research and how to present findings. We provide platform for disseminating research, and we also look for opportunities for networking and impactful discussions to ensure that researchers can reach people in power and effect meaningful change. Over the past 8 years, we have provided over $7.2 million to 68 research programs in 36 countries. And between 2014 and 2020, we provided 19 grants for projects in Africa. Next slide, please. We have published now a series of regional reports for 3 of our major low and middle income countries regions, Africa, Asia, and Latin America, and the Caribbean, to showcase some of the fantastic work we supported between this period I mentioned. Each report highlights a few of our research projects within each region. And for each study, the report identifies the researchers, describes the scope of the work, the knowledge gaps addressed, findings and impacts, and lessons for the field. We see this report as important tools. We believe they will help us reach more people and potential partners and promote the innovative work researchers in low and middle income countries are doing. Next slide, please. We are very pleased to launch today the Africa Regional Report, which discusses 6 projects from Uganda, the DRC, and Kenya. The Ugandan project, Parenting for Respectability, aimed to find out if improving parenting skills would contribute to reducing intimate partner violence and violence against children. Very much what we were talking about just now in the panel. The project was implemented by the Makerere University, University of Glasgow, the Ugandan Medical Research Council, and the SVRI. After an initial pilot and manual development, about 600 men and women in central Uganda participated in a larger pilot. The participants worked through a 15-week process with weekly 2 to 3 hour sessions involving parental bonding and attachment, harsh discipline, gender socialization, and conflict resolution, especially between spouses. The findings are extremely positive. Children reported a 30% drop in spousal violence and a 27% drop in harsh parenting. The community members and participants were very positive about this program. Next slide, please. We still know, and again, like the colleagues from Sendeka were talking about, we still know very little about the impact of economic empowerment programs on violence, and particularly on IPB. A project consortium conformed by Sendeka and the Global Women's Institute at George Washington University assessed whether Sendeka's agriculturally focused economic development programs combined with a gender transformative approach is a promising mechanism for reducing intimate partner violence. And the impact of the intervention was very positive, as you can see in the graph in your screen, as you have heard from the colleagues from Sendeka in the panel. Overall, there was a reduction in violence of more than 60%. 21% of women said sexual violence had stopped, and 46% of women said it had decreased. So these are really, really very, very positive results of this intervention. As again, echoing what was said just in the panel, we need to have this comprehensive intervention. Next slide, please. Another very interesting research project by Promundo and the Living Peace Institute in the DRC evaluated the impact of an initiative developed and piloted in 2013 with 324 men and their partners. Over the 15-week pilot, men participating in the intervention consciously worked towards bringing peace and harmony into their lives and homes. This process enabled them to discuss how war and conflict had influenced the way they define being a man and to explore pain and trauma. And the researchers found really important and sustained change over the years, including that the violence at home had stopped in 30 out of the 40 families since 2013. Men, big majority, have accepted their wives after they were raped, as well as the children that were born after the rape. 10 families reported relapses of men's behavior, primarily due to alcohol abuse or conflict and stress around money and unemployment. And we can see here the impact of external structural issues. Women in 10 families with relapses of the husband didn't experience physical or sexual violence anymore. And of course, the methodology has been adapted for use to other traumatized populations with promising results, adolescent boys in Cameroon, schools-based programs with the Syrian adolescents in Lebanon refugee settlements, also with the urban gangs in Kinshasa, young people, And currently the method is also implemented in communities of high urban violence in Pittsburgh. So yet again, fantastic research uptake of these projects. Then one very interesting in terms of response, the project implemented by Physicians for Human Rights aims to explore the use of a mobile application to help clinicians preserve documentation that can be used as medical evidence in police investigations and criminal trials. The project has worked alongside the Kenyan government to meet medical and legal requirements and at the site level to ensure integration with everyday office practices. Very interesting application. It works securely offline to address issues like power outages and lack of a stable internet. The application provides personal support to the users, ranging from technical training in typing and photography to weekly feedback on clinical practice and interpretation of injuries related to sexual violence. Preliminary findings are extremely positive. And just this year, the Humanitarian Innovation Fund awarded a grant to Physicians for Human Rights, who will now be able to see if the application can be piloted and scale up to other countries all over the world. So again, a fantastic impact of this grant. Next slide, please. Now moving to something quite relevant and kind of very also was mentioned by some of the panelists about the new forms of violence. The study conducted by the International Center for Research on Women addressed an emerging phenomenon that is under research, particularly in low and middle income countries, and poses an acute threat to public health and human rights. And we have all witnessed an increase of this manifestation of violence during the COVID-19 pandemic, violence against women and also violence against children. The study created a set of measurement tools and a standardized research framework to understand the prevalence and impact of this new form of global violence. In addition, the work led to a draft set of quantitative measures that can be further validated and used to collect critical data on this issue. The framework, once again, has been widely disseminated and used by non-governmental and feminist organizations, universities, government, and donor agencies. Next slide, please. In this research, which is again very much in line with what the panel was discussing, the partners Raising Voices and Columbia University conducted a mixed method study to understand perceptions and experiences of intersecting forms of violence in Uganda, while also capturing positive, loving, and respectful family dynamics. The quantitative analysis of the data from caregiver-child pairs indicates that nearly 75% of the pairs reported violence against children and/or violence against women, and 1/3 reported co-occurring violence against children and women in the household. The qualitative analysis suggests that co-occurring violence against children and violence against women is a common experience in participants' families, and that patriarchal gender norms, family hierarchies, and an emphasis on disciplining children create an environment that normalizes many forms of violence. The research identified 4 common patterns of intersecting violence, highlighting the following cycles of physical and emotional abuse. Bystander trauma, meaning women and children express distress or trauma after witnessing violence against another family member. Role modeling, children, especially boys, and again, going back to the comment from Pinky about the need to really understand better men and boys, children, especially boys, may adopt abusive behavior after witnessing intimate partner violence. They could also lose respect for their mother after witnessing violence against her. And protection of and further victimization. The mother or child tries to stop the husband or father using violence against the family member, often triggering further abuse. And displays aggression. Parents intentionally use children to retaliate against each other, or women redirect violence against themselves to their children. So these results indicate the potential for more streamlined programs that draw on insight from the research, provided though that important differences between women-centered and child-centered programming are considered. And this is also very interesting, and going back to the innovation coming from the continent. At the time, no similar research had been conducted in sub-Saharan Africa. So this has been an extremely quick tour of the research projects showcased in the report, but I think it gives you a flavor of the relevance of the impact of the research in the field that has been conducted in the continent. I invite you to visit our website where you will find the full report and also links to other and more information on each of the projects. Thank you so much, Diana.
Thank you, Angelica. So I think we're going to move on to our question and answer session. And so I was wondering if there are any questions that the panelists have read or anyone has read that they would like to respond to. If not, I'll start providing questions. But one of the questions directed, especially at Peg and Sylvia, was if you could provide a little bit more insights into the monitoring of intimate partner violence in your intervention and how you adopted the tools. I think, Sylvia, you spoke a little bit about you're collecting data. How does that look now versus before in the monitoring and evaluation work that you did?
Thank you for that question. Sorry, I have to go off camera. My network is not strong enough. SVRI has been able to collect data continuously. And after the research, we also developed a tool that we use to collect this data. And this tool has been embedded in, among other tools that we use to collect, to do our baseline surveys, to do impact surveys, and even to collect data for evaluation. So it is a continuous progress throughout the project, collecting this data continuously and looking at it to inform if the direction of the trends after doing these interventions.
Thank you so much. We also had a question come in on anyone that had examples of how can boys and men be effectively engaged or involved in addressing gender-based violence. I was wondering if anyone, Angelica, from the research summary, you have any insights on that, or anyone else. I know, Sylvia, again, you also work at the family level. So any effective strategies for engaging men and boys that you've come across?
Maybe I can go, Diana. So you can see I mentioned there, of course, it's very specific to men that have been through the conflict, of men and women in DRC through conflict. But I think that's an evidence of an intervention that really kind of proves that psychosocial interventions do work with men. So there was a reduction there, obviously. So that's a key example, the one I just mentioned. You can visit the report and see more. But I think we have seen more to another project, Rakai and Health Services in Kenya also had an intervention where they included men and boys. We will have another specific webinar on thematic brief. We call them this one, specifically engaging men and boys. So whoever made a question, please join us for that one. We will talk more about that. But I think there are several now, and we have learned a lot also how to do it properly with a feminist approach. So come to the webinar, you will learn more. But from this particular brief, this report, you will see the one from the DRC with Promondo.
Great, thank you. Anyone else want to come in on that question? If not, I have a question for Chichi, if you're still there, Chichi. Is there a universal assessment tool for gender-based violence that organizations can use? We talked about organizations maybe not focused on GBV, but working with women in communities. Do you know of any assessment tool that organizations can use to try to begin to understand the complexity?
Thanks. I mean, I think that's a really great question. It really shows the interest and the need for this. Well, the term universal is rather tricky. It really depends on, what it is, what kind of organization, what it is exactly that they're trying to find out when it comes to violence. But we do have tools that have been used that are regarded as global tools used in a variety of different countries, including those developed by the WHO, for instance, for their multi-country study on violence against women. That sort of thing. I'm not sure if the question was around women only, but we also have sort of the violence against children survey tool and so on and so forth. So there are a number of robust tools that have been used in many different countries in the world, and it really just depends on what exactly the organization concerned is interested in exploring. But there is a starting point, and these tools are publicly available. Thank you.
Great. Thanks so much, Chichi. That's important. And it is exciting that that question came through, because it does kind of give us hope, and that others will start kind of questioning and interrogating what they can do to contribute to the reduction of violence against women and violence against children in the communities that they already work in. I think this has been such a rich panel and set of presentations by Chichi and Angelica. Thank you so much. And Liz, I'll hand it over to you to summarize some key lessons and send us off. Thank you so much for inviting me.
Oh, thank you all. I think, as you have just said, it's been such a rich and wonderful discussion, and we are so excited to be launching these series of learnings that are coming out of the field on behalf of the SVRI and the World Bank Group and our wonderful grantee partners. So I really just want to give some brief words of thanks. First, thank you to you, our participants, for spending your time with us today and to sharing your questions and sharing who you are and where in the world, and thank you for participating. A big thanks to our wonderful, wonderful panelists and speakers. It's been really wonderful to hear from you, to hear your learnings. We have really been able to, I think, with this small grants that we've been giving, well, not so small, but grants that we've been giving, I think we've been really being able to move the field forward. And thank you to the World Bank Group for partnering with us on this journey. And I hope we continue to partner with you as we move forward. I'd also like to thank the SVRI and the World Bank teams for pulling together both these reports, these webinar series, and pulling together the field in a way that can advance research on violence against women and our learnings more generally. And I'd like to thank our Zoom producer, Liesl, for all the hard work in keeping us on track and on hand. And then I'd like to put out a call to all of you, whether you are a researcher, a policymaker, a practitioner, a funder, or an activist. We invite you to join our community. We're a community of diverse voices committed to really addressing and ending violence against women and violence against children. And you can learn more and join us by getting in touch. You can apply for a grant through our website. So please join us. And Lisa will share the contact details in the chat. So again, I want to say thanks to everybody, and thank you for this really wonderful, wonderful webinar. If there are any questions that we haven't answered, we will get back to you, because we do have everybody's contact details, and the webinar slides and the information will be shared via email and by our websites. Again, thank you for spending time with us, and thank you all for joining us. We look forward to more of these wonderful launches. Thank you.